So those are the two approaches, either freezing your eggs or freezing ovarian tissue. We could do one of them or we could do both of them. And it depends a lot on your personal decisions. You could see there'd be advantages or disadvantages to each of those methods. Well, let's just talk about the egg freezing because it's a pretty spectacular advance by Dr. Kouyama at the Kato Clinic in Tokyo. And we spent a lot of time with them, and they spent a lot of time with us, and we are affiliated with them. And so we have been able to really copy this technique, and we're very, very excited about it and comfortable with it. Now, first you just see that using this vitrification technique for embryos or blastocysts, these would be from an IVF cycle where you have extra embryos. The results are really fantastic. Survival rates that are close to 100% with embryos. And normally you hear quoted 50% survival rate. Good programs might have even more than that. But vitrification, as opposed to slow machine freezing, has absolutely revolutionized freezing of embryos, so that with impunity we can really limit how many embryos we replace in an IVF cycle and not worry that we're damaging the extra embryos that we're freezing. So we don't have to feel forced into transferring too many embryos at a time, and we don't have to be forced into maybe risking a dangerous multiple pregnancy, right? But that isn't what we're talking about right now. What we're talking about right now is freezing the eggs. Because in the past, it would be actually rare for a frozen egg to either survive or to result in live offspring. And the reason for that is that when we're freezing, 70% of all of you, 70% of your body and 70% of your egg is going to be water. And when you put a milk bottle in a freezer, it expands as it forms ice, and it breaks the glass, and the milk bottle breaks. So we all know as water freezes into ice, it expands, and that expansion causes damage. Builders all know when water gets into cement and leaks into it, and then it freezes as ice, it cracks the cement. You know, we're aware of in our practical daily life how whenever water gets into anything and then it freezes, that causes damage. And it really destroys your cells. In fact, you could walk into a freezer and survive being frozen, except for the fact that the water inside your cells turns into ice, and the ice then destroys the inside of your cells. So how does cryobiology work? Well, classically the way it works is we try to draw water out of your cells. And if we can reduce the water content from 70% to 30 or 35%, then you have less damage from ice crystal formation. And that's the whole idea of cryobiology. And we've been doing this for 30 years with embryos. It doesn't work with eggs. Eggs, at least mature eggs that are ready for ovulation, that you can collect because their chromosomes are carefully lined up on a spindle, are so sensitive to any ice crystal formation that although you can freeze embryos successfully with these techniques, and we've done it for decades, you can't freeze eggs because you're going to damage that chromosome or that gene spindle. The spindle on which the genes are located is damaged, and that really destroys the egg. It may even look normal, but it's never going to result in a viable baby. So that's why egg freezing has been such a problem. Now with vitrification, and this is a scientific diagram of it, we use a much higher concentration of antifreeze, the cryoprotectant, and we freeze it instead of 0.3 degrees centigrade per minute, we freeze it at 23,000 degrees centigrade per minute. I mean, I am talking about a 60 to 70,000 times faster rate of freezing than the classic slow freezing method. And so that means that ice crystals just can't form at all. We're not removing water from the cell. We are removing some, but we're not removing much water from the cell. What we're doing is completely preventing any ice crystal formation whatsoever. And this technique means that we can freeze eggs, mature eggs, with very little loss, only a 5% loss. So it's pretty fantastic, and we really didn't have this a year ago. We have it now, and so that is definitely an option for you, is just to freeze your eggs. Now here's another diagram of it. I don't want to make it sound simpler than it really is. It is critical that you not have the eggs in this vitrification media for too long, for say over a minute, because that can damage the egg in itself. So you have to be very quick, and you have to be very practiced and technically skillful. But when you put it in liquid nitrogen, in this manner, this diagrammed here, then you have no ice crystal formation and no damage. And then you have to thaw it quickly also and get it out of that high concentration medium within a minute after you thaw. So I don't want to make it sound like it's just a piece of cake and it's easy, but with a lot of practice, the laboratory can do it, and we've been doing it for about a year now, and we're very comfortable that it works. And this is just a picture of the straw that we place the egg on. And it's just a simple, I mean, it's very, very simple. It just requires some practice to do it right. But here, more interesting to you, are pictures. This is what an egg looks like before vitrification up in the upper left. And then just after thawing, you can see that the egg is not degenerated. But 2 hours after thawing in culture, it looks completely normal. It looks like as though it was never frozen. It's fertilized the next day, and you can see it looks like a normal fertilized egg. And 2 days later, it looks like a normal 4-cell embryo. And in 5 days, it's a normal blastocyst. So this is just a typical picture that despite the egg having been frozen as a mature egg, it is perfectly capable of normal development. And the thing is, when we freeze your egg, at whatever age you are, that egg doesn't get any older. Not only are we preserving your egg so that, you know, let's say you're worried about running out of them because your antral follicle count is low. Not only won't you run out of them because you've got frozen eggs that are preserved, but that egg doesn't age. So you've got a double advantage. If you do this at age 25, you've got a 25-year-old egg that you're trying to get pregnant with when you're 40 years old. And so it's a much better egg, which with much less likelihood of any kind of chromosomal age-related damage. So in two respects, you're preserving your fertility. You're keeping the eggs from aging, but you're also just keeping them from disappearing because you're holding them in the freezer.